আসসালামু আলাইকুম। সবাইকে আন্তরিক শুভেচ্ছা জানাচ্ছি। আপনারা জানেন আজকে ওয়ার্ল্ড হাইপারটেনশন ডে, সারা বিশ্বে ওয়ার্ল্ড হাইপারটেনশন ডে পালিত হচ্ছে। সেই হিসাবে বাংলাদেশ কার্ডিয়াক সোসাইটি আজকে এই সায়েন্টিফিক ওয়েবিনার আয়োজন করেছে। এতে আপনারা যারা আসছেন তাদেরকে আমাদের পক্ষ থেকে শুভেচ্ছা জানাচ্ছি। ACME ফার্মাসিউটিক্যালস এই সায়েন্টিফিক পার্টনার, তাদেরকে ধন্যবাদ জানাচ্ছি। আজকে আমাদের এখানে দুজন বিশিষ্ট স্পিকার আছেন, আপনারা সবাই তাকে চিনেন। প্রফেসর মোহাম্মদ মামুনুর রশিদ, প্রফেসর অফ কার্ডিওলজি, NICPD ঢাকা, অলসো ট্রেজারার অফ বাংলাদেশ কার্ডিয়াক সোসাইটি। আরেকজন আছেন ডক্টর আব্দুল্লাহ জামিল, সিনিয়র কনসালটেন্ট, আজগুর আলী হাসপাতাল। I am requesting Professor Mamunur Rashid to start your talk, your presentation topic, Management Update of Hypertension 2022 Update. Professor Mamunur Rashid, please share your screen.
মহসিন
জি,
ওই যে স্ক্রিন শেয়ারের পারমিশনটা শেয়ার করতে বলো।
হ্যাঁ শেয়ার করে দেন। সাউন্ড রাফি একটু শেয়ার করো। Anybody help Professor Mamunur Rashid to share his screen?
স্ক্রিন শেয়ার করছো না? কি সমস্যা? এন্টার দেন
স্যার।
প্রফেসর মহিবুল্লাহ স্যার চলে আসছেন। প্রফেসর মহিবুল্লাহ স্যার চলে আসছেন। প্রফেসর মহিবুল্লাহ স্যার, আসসালামু আলাইকুম স্যার। স্যার শুনতে পাচ্ছেন স্যার?
Recording in progress.
Professor Mohibullah sir, I am requesting you please give some opening remarks before we start our session. Professor Mohibullah, President of Bangladesh Cardiac Society.
আমার ছবি থাকবে।
স্যার শুনতে পাচ্ছেন স্যার?
ওকে থাকবে, তুমি এত কিছু করো না, খালি স্ক্রিন শেয়ার করো। স্ক্রিন শেয়ার করে না, স্ক্রিন শেয়ার করে না।
সাউন্ড কম শোনা যাচ্ছে, সাউন্ড নাই কেন?
স্যার মহিবুল্লাহ স্যার, আপনি ইয়েটা করেন, মিউটটা করেন, আনমিউট করেন স্যার।
স্যার আনমিউট করেন স্যার, কথা শোনা যাচ্ছে না স্যার।
হ্যাঁ শুনতে পাচ্ছেন?
জি স্যার বলেন স্যার।
হ্যাঁ শুনতে পাচ্ছেন? ওকে
স্যার।
সবকিছু ঠিকঠাক আছে তো?
জি আলহামদুলিল্লাহ স্যার, সবকিছু ঠিক আছে।
এখন শুরু করা যাবে?
আমরা রেডি স্যার।
আচ্ছা ঠিক আছে,
আপনি ওপেনিং করে শুরু করেন, আমরা রেডি স্যার।
থ্যাংক ইউ ভেরি মাচ everyone participating in this Zoom webinar, a hybrid webinar from our central office as well as from the webinar. I am congratulating everyone. I am welcoming everyone for participating in this Zoom meeting organized by Bangladesh Cardiac Society and ACME Pharmaceuticals Ltd on the occasion of World Hypertension Day. Today our speaker is Professor Dr. Mamunur Rashid and Professor Dr. Jamilur Rahman, naki? Dr. Jamil Ahmed, both our speaker. And I would now request Dr. Mohsin Ahmed to initiate the meeting and to invite the speakers to give their lectures. Thank you very much.
Thank you, sir. Thank you, sir. I already asked Professor Mamunur Rashid, please share your screen. And I think there is sound problem. Shaun and team and Rafi, please clear the sound.
আমাকে শুনতে পাচ্ছেন?
হ্যাঁ, শোনা যাচ্ছে, শোনা
Screen
যাচ্ছে,
দেখা
বলেন।
যাচ্ছে? Screen share? Honorable Chairperson, respected panelists and dignified participants of the member of the Cardiac Society, Assalamu alaikum. Today's lecture on the occasion of the World Heart Day 2022 is treatment of hypertension in a special situation. All of we know the general management of the hypertension, so I just like to emphasize on the treatment of the hypertension in some special situation. Here we at first the treatment of hypertension in patients with coronary artery disease. A strong epidemiological interaction exists between the coronary artery disease and hypertension that accounts for 25 to 30% of acute myocardial infarction. In case of coronary artery disease, the acute condition, the blood pressure should be lowered if blood pressure equal or more than 140/90 millimeter of mercury. And target blood pressure should be the less than 130/80 millimeter mercury. In case of elderly patient, less than 140 and 80 millimeter mercury. In coronary artery disease patients with elevated diastolic blood pressure and with evidence of myocardial ischemia, lower blood pressure slowly. Blood pressure should be lowered slowly and do not decrease the diastolic pressure less than 60 millimeter mercury in patients with diabetes mellitus and age more than 60 years, according to the International Society of Hypertension 2020 guidelines. Recommendation, lifestyle modification, which I did not mention here. The drugs should be here included, that is ACE inhibitors and ARB beta blocker with or without calcium channel blocker. In acute coronary syndrome and no contraindication to beta blockers, initial therapy should include a short-acting or selective beta blocker within 24 hours of presentation. In patients with acute coronary syndrome and hypertension, consider nitrates to lower blood pressure and to relieve ongoing ischemia. Add an angiotensin converting enzyme inhibitor or ARB for patients with anterior MR or in case of LV dysfunction, heart failure and diabetes mellitus. Lipid lowering treatment with an LDL-C target less than 55 milligram per DL. Antiplatelet treatment with acetylsalicylic acid, this aspirin is routinely recommended. It is also International Society of Hypertension 2020 guidelines. According to ESC 2019 guidelines, there is treatment of chronic coronary syndrome, a recommendation for hypertension treatment in chronic coronary syndrome. Here, the blood pressure should be systolic blood pressure 130 to 30 millimeter mercury in general, and 130 to 140 in case of older patient more than 65 years. It is +1 indication. Another is in hypertensive patient with a recent MI, beta blockers and RAS blockers, that is ACE inhibitor A and B are recommended +1 indication. In patients with symptomatic angina, beta blockers and calcium channel blockers are also recommended in class 1 indication. The combination of ACE inhibitors and ARB is not recommended, that is class 3. Treatment of hypertension in heart failure. There is blood pressure lowering treatment should be considered if blood pressure is more than 140/90 millimeter mercury and target blood pressure is 130 to 80 millimeter mercury in case of heart failure with reduced ejection fraction and heart failure with preserved ejection fraction both. Heart failure with reduced ejection fraction with hypertension, drugs should be the considerable here, the ACE inhibitors, ARB, diuretics and mineralocorticoid receptor antagonists and a beta blocker if required. But beta blockers should be avoided in case of acute worsening of the heart failure, that means acute left heart failure. Sacubitril, valsartan lowers blood pressure, improve outcomes in patients with heart failure with reduced ejection fraction is indicated as an alternative to ACE inhibitors and ARB. But sacubitril and valsartan combination is a class 2B indication in case of heart failure with preserved ejection fraction. No non-dihydropyridine calcium channel blockers, the verapamil, diltiazem are not recommended in the treatment of hypertension in adults with with heart failure with reduced ejection fraction. Here little bit change is done. Previously it is contraindicated in ejection fraction is less than 40%. Now it is contraindicated in case of ejection fraction less than 50%. Dihydropyridine calcium channel blockers, that is amlodipine, nifedipine may be added if blood pressure control is not achieved. It is class 2 in B indication. Treatment of hypertension in patients with heart failure with preserved ejection fraction. There is in adults with heart failure with preserved ejection fraction who present with symptoms of volume overload, diuretics should be prescribed to control hypertension. Adults with heart failure with preserved ejection fraction and persistent hypertension after management of volume overload should be prescribed ACE inhibitors or ARB and beta blockers titrated to attain systolic blood pressure less than 130 millimeter mercury. Management of hypertension in cerebrovascular disease. In acute ischemic stroke, routine blood pressure lowering with antihypertensive therapy is not recommended except in the following condition. Patients who are eligible for IV thrombolysis, that which patient we thinking that thrombolysis should be done, blood pressure should be carefully lowered 185 to 110 millimeter mercury before thrombolysis and maintain at less than 180 to 105 millimeter mercury for at least the first 24 hours after thrombolysis. In patients with markedly elevated blood pressure who do not receive thrombolysis, drug therapy may be considered based on clinical judgment to reduce blood pressure by 15% during the first 24 hours after the stroke onset. In hypertensive patient with an acute cerebrovascular event, start antihypertensive therapy immediately in case of transgenic ischemic attack. Start antihypertensive after several days in case of ischemic stroke. First line treatment, that is IV labetalol, nicardipine, alternatively nitroprusside can be used. In previous stroke or transient ischemic attack, for prevention of recurrent stroke, RAS blocker plus a calcium channel blocker or thiazide-like diuretics can be used. Treatment for stroke prevention should not include beta blockers unless there is a compelling indication for their use. Lipid lowering treatment is mandatory with a LDL-C target. Here the target is less than 75 milligram per DL. Antiplatelet treatment is recommended for ischemic stroke but not hemorrhagic stroke and should be carefully considered in patients with hemorrhagic stroke only in the presence of a strong indication. International Society of Hypertension 2020 guidelines. Here is the algorithm. There is management of hypertension in patients with acute ischemic stroke. That is, in case of acute ischemic less than 72 hours and patient qualifies for the IV thrombolysis, if it is qualifies for the thrombolysis, then blood pressure should be less than 185 millimeter mercury and diastolic blood pressure less than 110. Already I mentioned it is class 1 indication. And maintain the blood pressure less than 180 and less than 105 millimeter mercury for the first 24 hours after IV thrombolysis. It is also cardioversion. But in case of which patient don't need it for the thrombolysis therapy and blood pressure less than 220 and 110 millimeter mercury, here the antihypertensive treatment is not recommended. But if the blood pressure is more than 220 and 110 millimeter mercury, blood pressure should be lowered 15% during the first 24 hours. It is class 2B indication. Patient with acute intracerebral hemorrhage, immediate blood pressure lowering is not recommended for patient with systolic blood pressure less than 220 millimeter. This is very important. In many cases, we ignore this and we start the blood pressure lowering treatment in case of intracerebral hemorrhage. In patients with systolic blood pressure more than 220 millimeter mercury, care for acute blood pressure lowering with IV therapy to less than 180 millimeter mercury should be considered. Here another algorithm, that is management of the hypertension in patients with acute intracerebral hemorrhage and less than 6 hours of symptom onset, there is spontaneous intracranial hemorrhage, systolic blood pressure 150 to 220 millimeter mercury, blood pressure should not needed lowering the blood pressure. And if the systolic blood pressure more than 220 millimeter mercury, Here the systolic blood pressure lower with continuous IV infusion and close vascular monitoring. It is class 2A indication. Management of hypertension, patients with a previous history of stroke, that is sedentary stroke prevention. In this case, that if the stroke period is more than 72 hours symptom onset and previously diagnosed, then restart the antihypertension treatment or previously continue the previous treatment. And if the previously not diagnosed and established blood pressure is more than 140 millimeter mercury and diastolic blood pressure more than 90 millimeter, then initiate the antihypertensive treatments. It is class 1 indication. And aim for systolic blood pressure less than 130 to 80 millimeter, it is class 2B indication. And established blood pressure, systolic blood pressure less than 140 millimeter mercury and diastolic blood pressure less than 90 millimeter. Usefulness of starting antihypertensive treatment is not well recommended, class 2B. Hypertension and chronic kidney disease, a lower of eGFR is associated with resistant hypertension, masked hypertension, and elevated nighttime blood pressure values. The effect of blood pressure lowering on renal function and albuminuria are dissociated from cardiovascular benefits. Blood pressure should be lowered if the blood pressure more than 140/90 millimeter mercury and treated to a target one less than 130/80 millimeter mercury, and in case of elderly patient less than 140/80 millimeter mercury. RAS inhibitor are the first line drugs because they reduce albuminuria in addition to blood pressure complaint. Calcium channel blockers and diuretics, there is loop diuretics if eGFR less than 30% can be added. Here I want to mention one thing, that is here the guideline shows that RAS inhibitor, that is AC inhibitor and these drugs, ARB, are the first line drugs. It should be kept in our mind. Here in protocol, there is management of hypertension chronic kidney disease. Here is a flow chart. There is hypertension with CQDD. If the patient have the proteinuria, then AC inhibitors, ARB, and calcium channel the first choice. And no proteinuria, one of two of the can be used. That is AC inhibitors, ARB, or calcium channel blocker, or thiazide-like diuretics. Treatment of hypertension with diabetes mellitus. Blood pressure should be lowered if blood pressure more than 140/90 millimeter mercury and treated to a target less than 130/80 millimeter mercury. In case of the elderly patient, it should be less than 140/80 millimeter mercury. The treatment strategy should include AC inhibitors, ARB, and calcium channel blocker and thiazide-like diuretics. The treatment should include a statin in primary prevention if LDL-C more than 70 millimeter, like acute ischemic stroke, and in diabetes with target organ damage more than 100 milligram DL in uncomplicated diabetes. The treatment should include glucose and lipid lowering as per guidelines. Treatment of hypertension with COPD. Hypertension is the most frequent comorbid in patients with COPD. Blood pressure seen previously, there is blood pressure should be lowered in case of 140/90 millimeter mercury and target pressure less than 130/80, and in case of elderly patient 140/80. Here is just a little bit more emphasis should be given, that is smoking cessation is mandatory. Environmental pollution should be considered and avoided if possible. And in case of beta blocker, there is a selective beta-1 receptor blocker can be used. Treatment of hypertension with obesity and metabolic syndrome, lifestyle modification by means of dietary modification, weight reduction, and exercise improves insulin sensitivity, the optimal antihypertensive drug therapy. AC inhibitor ARB reduces the arterial stiffness, and thiazide diuretics is not recommended because it increases the insulin resistance. Lipidemia and hyperglycemia and to accelerate the conversion of over diabetes. Traditional beta blocker is not recommended in obesity because it may lead to the dyslipidemia and deterioration of glucose intolerance and ability to lose weight. However, the newer vasodilating beta blocker like labetalol, carvedilol, nebivolol have shown neutral or favorable effects. Hypertension and lipid disorder. Hypertension is the most common comorbidity in patients with dyslipidemia. Blood pressure should be lowered as down in the general population perfectly with renin-angiotensin system inhibitors, that is ARB and AC inhibitor and calcium channel. Statins are the lipid lowering treatment of choice with or without ezetimibe, and PCSK9 inhibitor. Serum triglyceride lowering should be considered if it is more than 200 milligram per dl, particularly in patients with hypertension and diabetes mellitus. Management of hypertension in pregnancy. In case of pregnancy, hypertension may be mild hypertension, that is 140, 159 systolic and 90 to 109 diastolic pressure. First choice is beta blocker labetalol. Previously, we usually thinking that methyl dopa is the first choice, but nowadays the beta blocker labetalol is become the first line drug. And dihydropyridine calcium channel blockers, nifedipine, nicardipine, contraindicated, that is ACE inhibitors, ARB, and renin inhibition due to adverse fetal and neonatal outcomes. In case of severe hypertension in pregnancy, blood pressure more than 170 millimeter mercury and diastolic more than 110, immediate hospitalization if needed. Treatment intravenous first choice labetalol and esmolol, nicardipine, hydralazine, and oral methyl dopa or dihydropyridine calcium channel blocker. To prevent eclampsia, or add magnesium in case of hypertensive crisis. In pulmonary edema, nitroglycerin intravenous infusion can be given. Sodium nitroprusside should be avoided due to danger of the fetal cyanide poisoning with prolonged treatment. Resistant hypertension. In case of resistant hypertension, considering screening patient for secondary cause should be identified. Optimize the current treatment regimen, including the health behavior change and dietary-based treatment. Maximally tolerated doses of diuretics and use of thiazide rather than thiazide diuretics and initiation of loop diuretics, and a low dose of spironolactone as the fourth line agent in those serum potassium is less than 4.5 millimole per liter and whose eGFR is more than 45 ml per minute to achieve blood pressure targets. Here are some treatment of hypertensive emergency. There is immediate blood pressure should be reduced. In case of hypertensive encephalopathy and acute hemorrhagic stroke, systolic blood pressure more than 180 millimeter mercury, acute coronary events, acute cardiogenic pulmonary edema, acute aortic disease, eclampsia, and severe preeclampsia. In these cases, immediate blood pressure should be reduced, and drugs can be used, that is nitroglycerin in case of coronary arrhythmia, labetalol, in case of cardiogenic pulmonary edema, nitroprusside, nitroglycerin, and aortic dissection, that is esmolol, nitroprusside, and in case of eclampsia or severe replication, labetalol or nicardipine and magnesium sulfate. And malignant hypertension with or without acute renal failures, several hours we can be lowering the blood pressure. Here labetalol and nicardipine can be used. At last, the World Hypertension Day 2022 giving the slogan that measure of your blood pressure and accurately control it and live longer. We hope we will measure our blood pressure regularly and we will live longer. Thank you for patience hearing.
Thank you very much, Professor Mamunur Rashid. শোনা যাচ্ছে?
হ্যাঁ, জি স্যার।
হ্যাঁ, thank you very much, Professor Mamunur Rashid, for this elaborate presentation on management of hypertension. He
special situation
had spoken on various aspects of various problems of hypertension management. Now I would request Dr. Abdullah Al-Jamil to present his presentation, and afterwards we will have discussions on the issues. Professor Abdullah Al-Jamil, please.
Thank you, sir. Am I audible?
Yes, yes.
Thank you, sir. First of all, I thank the Cardiac Society for inviting me to give a lecture. Respected President of the Society, General Secretary, and dear audience. Today I am going to talk on, I am sharing my screen. Is it visible?
Yes. Yes.
Okay, thank you, sir.
Proceed on.
Thank you, sir. So I shall be talking on technique of proper blood pressure measurement and benefit of home BP monitoring. Proper blood pressure or BP measurement is the key to diagnose and reassess the patient of hypertension. Why proper pressure measurement is important? Proper blood pressure measurement is the key to the diagnosis and hypertension, and it is important to get an accurate blood pressure reading so that a person will have a clear picture of his or her risk of heart disease and stroke. According to the American Heart Association, systolic blood pressure indicates how much pressure a patient's blood is exerting against the arterial wall when the heart contracts. And diastolic blood pressure indicates how much pressure a person's blood is exerting against the arterial wall while the heart is resting in between two contractions. So this is the types of category of blood pressure level already discussed by Dr. Mamunur Siza. Types of blood pressure measurement. One is direct measurement, that is invasive from the lumen of the artery, and another is indirect measurement, the non-invasive technique, the usual technique we use in the day-to-day clinical practice. These are instruments or devices used for measuring indirect blood pressure. The gold standard is mercury sphygmomanometer, but it is cumbersome. It's a large device, cumbersome to carry, and it has a mercury column. And this mercury often gets changed with contact with the air oxygen and become mercuric oxide. It needs to be cleaned periodically. And if it is dropped, the mercury gets out. Difficult to buy or acquire mercury from the market. The most common and popular one is aneroid sphygmomanometer. It has a meter and a cup. All the other components, instead of mercury, there is a meter. And the more now popular to the general people is the digital or electronic sphygmomanometer. It has a monitor screen where it is blood pressure is displayed together with the heart rate. So patient's position during the blood pressure measurement. Sitting position is the ideal, with back supported on the chair. Arm should be bare and supported on the table. Use a cup size appropriate for the patient's arm. Middle of the cup at the heart level, in the same level of the heart. Lower edge of the cup 6 centimeter or at least 1 inch above the elbow crease. Do not talk or move before or during the measurement. Legs should be raised on the floor uncrossed. Methods are two types. One is palpatory method, another is auscultatory method. This palpatory method is often neglected, and it is important as because in the elderly or old patient whose systolic pressure often is very high, and if and often they have a silent gap in between the systolic and diastolic blood pressure. When the auscultatory method is used, we look for the Korsakoff sounds. I'll come later on. And in when the cuff is deflated around 190, 180, the Korsakoff sound disappears suddenly, and again reappear around 150 or 140. And this gap period is called silent gap. And if the palpatory method is not used, often the examiner miss the true systolic pressure. So now I come to the well, this is the hand. The cuff should be tied up like this. And here, when it is fully inflated, the brachial artery is occluded and then gradually deflated and flow reestablishes. And ultimately, when the fully deflated, before fully deflation, the diastolic blood pressure is recorded. I shall come to next one. What is Korotkoff sounds? Korotkoff sounds are generated when the blood pressure curve changes the flow of blood through the artery. These through the Doppler machine, Doppler probe that is placed distal to the blood pressure curve. Sounds. There are 5 distinct phases of Korotkoff sounds. Phase 1, a sharp tapping. This is the first sound heard as the cuff pressure is released. This sound provides the systolic blood pressure reading. Phase 2, a swing, whoosing sound. Swing sounds are blood flow through the blood pressure as the cuff is more deflated. Phase 3 is thump, softer than phase 1. Intense thumping sounds that are softer than the phase 1 as the blood pressure flow through the artery, but the cuff pressure is still inflated to occluded flow during diastole. Phase 4, a softer blowing, muffled and sound that fades. Softer and muffled sounds as the cuff pressure is released. Change from the thump of phase 3 to muffled sound, this phase 4 is known as the first diastolic reading. Most of the authorities count this phase 4 as the diastolic blood pressure, and phase 5 when this Korotkoff sound disappears, and this is known as the second diastolic reading. And it is recommended to record diastolic pressure as, say, if the muffling came on at 80 millimeter and it disappeared in 75, so it should be written as 80-75. These are the phases of example of different phases. Common problems during blood pressure measurement. Stress and anxiety. If someone is experiencing stress immediately before or during blood pressure measurement, the spike in cortisol level will cause the heart rate to increase and should result in a higher blood pressure measurement. A full bladder, when the bladder is full and the pressure on the kidney exerts pressure on the blood pressure. Crossed leg. Crossed leg during a blood pressure reading can raise the result by 2 to 5 millimeter. Cuff placement. Most blood pressure reading errors are result of improper size of the cuff and placing the cuff over the clothing. Eating or not eating. Right after eating a meal, blood pressure will often read lower than normal because digesting food actually lowers blood pressure as the circulation is diverted to the abdomen. Caffeine and tobacco, the consumption of these cause blood pressure to rise immediately. Too much talking. Talking during measurement can increase the reading. Why does someone need to monitor blood pressure at home? This is the benefit of home BP monitoring. Help early diagnosis. Self-monitoring can help doctor diagnose high blood pressure earlier than if someone has only occasional blood pressure reading in the hospital or offices. Help track the treatment when the only way to know whether someone's lifestyle changes or medications are working is to check the blood pressure regularly. Monitoring blood pressure changes at home can help the person and his or her doctor make decisions about the treatment, such as adjusting doses and changing medication. encourage better control. Self-monitoring can give a stronger sense of responsibility of health. The person may feel even more motivated to control his or her blood pressure with an improved diet, physical activity, and proper medication. Cut the healthcare cost. Self-monitoring might decrease a person's number of visits to the hospital or doctor's office. Help to check whether blood pressure differs outside doctor's office. Some people experience spikes in blood pressure due to anxiety while visiting a doctor. That is white coat hypertension. Others have normal blood pressure at the clinic but elevated elsewhere. This is masked hypertension. Monitoring blood pressure at home can help determine if he or she have true high blood pressure. Types of home monitors. An automatic and electronic device is recommended. Discuss the choice with your doctor so that you pick the monitor that is best for your situation. Monitors generally have the same basic parts. So there's inflatable cuff and gauze for readouts. The cuff's inner layer fills with air and squeezes the arm. The cuff's outer layer has fastening to hold the cuff in place. Heart rate and blood flow are automatically calculated by measuring the changes in the motion of your artery as the blood flow through while the cuff deflates. And gauze for readout. Some blood pressure monitors can take multiple readings and report the average. There are some public blood pressure machines which are found in the dispensaries and pharmacies. Public blood pressure machines such as found in the pharmacies may provide helpful information about blood pressure, but they may have some limitations and the accuracy depends on the correct cuff size and proper use of machine. The person should ask his or her doctor to advise on using public blood pressure machine. Features to consider. When choosing a blood pressure monitor, a person needs to consider cuff size. Having a properly fitted cuff is most important factor to consider because poorly fitted cuff will not give accurate blood pressure measurement. The person should ask the doctor what cuff size he or she needs. Display. The display that shows blood pressure measurement should be clear and easy to read. Device accuracy. Before buying a blood pressure monitor, the monitor has to be validated, meaning its readings are accurate and repeatable. Once a year, need to check the accuracy and need to compare the monitor's reading with those taken by the doctor. Tips for accurate use. Devices accuracy need to be checked. Blood pressure need to be measured twice daily. Should not measure blood pressure right after waking up. Should avoid food, caffeine, tobacco for 30 minutes before taking a measurement. Need to sit quietly before and during monitoring. Arm need to position properly. Need to take a repeat reading. Decrease the chance of long-term benefits of home BP monitoring are decrease the chance of a stroke, protect kidneys, reduce out-of-pocket expenses, improves quality of life and increase lifespan, improves heart health. When a person has high blood pressure, he or she has 3 times more likely to die from heart disease. Thank you all. Keep your blood pressure in control. Thank you very much for patient hearing.
So thank you very much, Dr. Abdullah Jamil, for your nice presentation for measurement of heart failures in different conditions. Now I would request our viewers if they have any questions to the speakers. If they have any questions, please ask to the speakers directly by unmuting yourself. For asking the question, you have to unmute yourself. প্রবীর দাস বলেন, ডক্টর প্রবীর বলেন।
স্যার স্ক্রিনে তো কিছু দেখছি না।
হ্যাঁ, কেন শুরু দেখা যাচ্ছে স্ক্রিনে সবাইকে। আপনি বলেন, আপনি বলেন।
স্যার thank you for giving me the chance to speak a few words, and thanks to the Cardiac Society for arranging such a program on the eve of World Hypertension Day. In Bangladesh, possibly more than 22% of the adult population are hypertensive, and it is increasing more and more with growing aging of the population and obesity. And possibly this increased prevalence of hypertension contributes to the epidemic rise of coronary artery disease in this part of the world. Also, for our general population, only 1/3 of the adult possibly measures their blood pressure. So this is the day where the hypertension league is urging upon to measure blood pressure for the general population. Although this is a very simple thing to do, as Dr. Abdullah Jamil mentioned, measuring blood pressure, but the measurement should be done accurately, and all the health personnel should measure blood pressure. We often see that people dealing with medicine, cardiology, nephrology, neurology, these people who are known as internists only measure blood pressure. And very often the other people dealing on the surgical side and other part of our medical science does not bother to measure their blood pressure of their patient. This is an unfortunate thing. This day urges all the medical professionals to measure their blood pressure, irrespective of whether they are cardiologists, nephrologists, or internists. And in that way, the hypertension will be detected. And the good thing is, if hypertension is well controlled, the complications may be prevented. And if the blood pressure is done, measured accurately, if it is controlled, the longevity of the affected persons will be. It is not like that of diabetes mellitus. Diabetes mellitus, you will see that even after controlling diabetes mellitus, there are so many micro and macrovascular complications. But here in hypertension, if it is adequately controlled, most of the complications are prevented, can be prevented. It is a good thing in hypertension compared to other metabolic conditions like diabetes mellitus. And also diabetes and hypertension go side by side. This is because of presence of insulin resistance, and about 70% of the diabetic patients are hypertensive. So along with that, the other comorbidities should be controlled, and the situations, special situations where blood pressure should be controlled, in which way, what drugs should be used, is nicely mentioned by Professor Mahmoud Rashid Sijar. So with these few words, I thanks giving my heartfelt thanks to the presenter as well as to Cardiac Society for arrangement of this problem. Thank you, sir.
Thank you very much, Dr. Professor Prabir Das. Now I request Professor Nawajesh Farid to give some comments, or if you have any questions to the speaker. Professor Nawajesh Farid.
Assalamualaikum.
Yes, we can hear you. Please continue.
ঈদ মোবারক। ফিজিক্যালি যে ঈদ মোবারক জানাতে পারি নাই, এজন্য দুঃখিত। তো আজকে যে কার্ডিয়াক সোসাইটি হাইপারটেনশন ডে উপলক্ষে যে সেমিনারটি ওয়েবিনারটি আয়োজন করেছে, এটা অত্যন্ত গুরুত্বপূর্ণ একটা সময়োচিত টপিক। দুটো যে সাবজেক্ট সিলেকশন করা হয়েছে সেগুলো অত্যন্ত ভালো এবং ওয়েল প্রেজেন্টেড। তো আমি মনে করি যে প্রফেসর মামুনুর রশিদ সিজারের যে প্রেজেন্টেশনটা, হাইপারটেনশন ইন স্পেশাল কন্ডিশন, এটা আসলে এই যে ড্রাগ সিলেকশন, এগুলো ব্যাপারে আমাদের দেশে স্পেশালিস্ট পজিশনে নয়, যারা মেডিকেল গ্রাজুয়েটস তারা যেন আরো ভালো ওরিয়েন্টেশন থাকে, এই জন্য তাদেরকে নিয়ে ওয়ার্কশপ করা উচিত বলে বা ওয়েবিনার করা উচিত বলে আমি মনে করি। এটা আমার একটা পরামর্শ। সেকেন্ড প্রেজেন্টেশনটা যে জামিলের প্রেজেন্টেশন, এখানে একটা জিনিস বুঝলাম না, উনি বলেছেন যে দিনে 2 বার ব্লাড প্রেশার মেজারমেন্ট বলেছেন কি আপনি?
হ্যাঁ বলেন।
হ্যাঁ, দিনে 2 বার।
মেজারমেন্ট।
আমরা তো আসলে এটা কি পোরলি কন্ট্রোল কেস গুলো নেই, তাই নিয়ে?
জি স্যার।
পোরলি কন্ট্রোল পেশেন্ট, আদারওয়াইজ এত ফ্রিকুয়েন্টলি ব্লাড প্রেশার মেজারমেন্ট রাদার ইট ইন্টারফেয়ারস উইথ দ্য কন্ট্রোল অফ ব্লাড প্রেশার।
ইয়েস স্যার।
তো আজকে যে স্লোগান, এটা খুবই টাইম ওয়ার্দি স্লোগান। আসলে আমাদের দেশের যে জনগোষ্ঠীকে হাইপারটেনশনের মেজারমেন্টের আওতায় বেশি আনতে হবে, তাদের ওরিয়েন্টেশন আসতে হবে যে হাইপারটেনশন ইজ এ কিলার ডিজিজ। সুতরাং বেশি মানুষ যেন বেশি ব্লাড প্রেশার রেকর্ড করেন,
কনসাইজ করেন,
হ্যাঁ প্রপারলি রেকর্ড করেন, এবং আগে যেন কমপ্লায়েন্স থাকে, এইটার দিকেই বরং বেশি জোর দেওয়া দরকার বলে মনে করি। এবং ইনভলভিং দ্য পিপল হু আর ইন কন্ট্যাক্ট উইথ দ্য জেনারেল পিপল, সেই সমস্ত ইনক্লুডিং দ্য পিপল ওয়ার্কিং ইন দ্য রিমোট এরিয়াজ, ইনক্লুডিং দ্য সেক্টরস, এটা করা উচিত বলে আমি মনে করি। ধন্যবাদ সকলকে।
Thank you very much, Dr. Nozis Farid. Now we have within ourselves Dr. Humayun Kabir from, I think he is from Chittagong or Cox's Bazar. Dr. Humayun Kabir, can you hear me? Dr. Humayun Kabir, can you hear me? Please unmute yourself. Dr. Humayun Kabir.
স্যার আপনি আমাকে শুনতে পাচ্ছেন?
হ্যাঁ শুনতে পাচ্ছি। আইদার
শুনেছি, আমার খুব ভালো লেগেছে। আমি কার্ডিওলজিকে এর জন্য ধন্যবাদ জানাই।
থ্যাংক ইউ ভেরি মাচ। আপনার কোনো
প্রোগ্রাম করবেন এই আশাবাদ ব্যক্ত করি। আসসালামু আলাইকুম স্যার।
আপনার কোনো কমেন্ট বা প্রশ্ন আছে কিনা টু দ্য স্পিকারস?
না স্যার, আমি দুজন স্যারকে ধন্যবাদ জানাই।
আচ্ছা, থ্যাংক ইউ ভেরি মাচ। Dr. Arif, I have seen you with ourselves. Dr. Arif, will you give some comment or you have some questions to the speakers?
Yes, sir. Thank you, sir. At first, I'd like to congratulate our two brilliant speakers, Mamrud Sizar sir and Abdullah Jamil sir. It's a great talk and we have learned a lot. The thing is that the current trend of hypertension in our country is underexplored, and the treatment pattern is also changed for last decade. So I think we can have an initiative from our cardiac society, as we have members in all the divisions and districts. So the current trend of hypertension and the treatment pattern, I think it can be done under the supervision of cardiac society. So, yeah, I think our president sir and secretary sir, if you take the initiative, and we want to conduct a study on this, sir.
Okay.
Thank you, sir.
আরেকটা আছে না?
করতেছি হ্যাঁ, শেষ হয়েছে। প্রফেসর মজুমদার, do you like to are you with us? Dr. Kamrul, I have seen you. Kamrul
আসতেছে না, দেখি
কামরুলকে দেখছি না তখন। প্রফেসর আব্দুল্লাহ আল শাফি মজুমদার, do you hear me? Kamrul, have you any questions or comments? Dr. Kamrul, Dr. Kamrul, will you unmute yourself? Professor Shafi Majumdar, would you please comment or give some, would you give comments, or you have any questions to the speakers?
So please unmute, sir.
Professor Abdullah Shafi Majumdar, please unmute yourself.
আমি আসলে লেকচারটাকে ওইভাবে ফলো করতে পারি নাই, যার জন্য
আপনি কমেন্ট করেন on measurement and management of the hypertension.
না, এবার which is very important to measure the blood pressure accurately. This has been emphasized on the slogan of this World Hypertension Day. Points to be remembered before we measure the blood pressure. But the thing is that nowadays it is recommended to have the digital blood pressure machine to measure the blood pressure. In that case, only it does not arise on the other factors, but the machine is to be standardized, and always even in the guidelines it is also mentioned that the measurement of the blood pressure should be standardized before you label it as the high blood pressure or normal blood pressure. So that is the very important thing, and in this year's slogan, they measure the blood pressure accurately. So this accurately is we should emphasize on this accurately.
So thank you very much, Professor Abdullah Shafi Muzumdar. Is there any participant to give comments or to have to ask any question to the speakers? Any participants to have any questions or give comments on these issues? I request the participants. Now I would request Professor Abdullah Shafi Muzumdar to speak something on the day of on this occasion of World Hypertension Day and this seminar in association with ACME Pharmaceuticals. Afterwards, I would request Mr. Firoz Mohiuddin of ACME Pharmaceuticals to give vote of thanks. Now, first, I would request Dr. Abdullah Shafi Muzumdar to speak something on behalf of Bangladesh Cardiac Society.
Thank you, Mr. President. আমরা আসলে এই ওয়ার্ল্ড হাইপারটেনশন ডে উপলক্ষে আমাদের এটা দ্বিতীয় প্রোগ্রাম আমরা পালন করতে যাচ্ছি বাংলাদেশ কার্ডিয়াক সোসাইটি ওয়েবিনার মাধ্যমে এটা করতে যাচ্ছি। এর আগে আমরা 15 তারিখে আমরা ইন পার্সন প্রোগ্রাম করেছি। তো আমরা আগেও বলি সব সময় যে অ্যাওয়ারনেস ইজ ভেরি ইম্পর্টেন্ট টু কন্ট্রোল দি ব্লাড প্রেশার এপিডেমিক pressure of the throughout the world, কারণ আমরা জানি যে there is increasing incidence of the high blood pressure throughout the different communities of the world. The reasons are the changing the lifestyle and also the changing the food habits and the lack of physical exercise. Even the air pollution is also considered nowadays as the risk factor for the high blood pressure, as well as the other mental stress and strain. কাজে আমাদের what is more important is to disseminate the awareness throughout the public as well as in the doctors community, which should be translated in that way that when the patient visits a doctor, whether it is a clinician, internist or the gynecologist or the nephrologist, everyone's blood pressure should be measured when the patient attends a doctor chamber or the hospital. By this way, we can find out a number of the cases which remain undetected. This is my comments on this day. Bangladesh Cardiac Society is committed to disseminate the awareness program throughout the country. আমরা আরো ভবিষ্যতে আমরা আরো কতগুলি হয়তো স্যাটেলাইট প্রোগ্রাম আমরা করব, বিভিন্ন সেন্ট্রালের বাইরেও আমরা স্যাটেলাইট প্রোগ্রাম করব যাতে আমরা ডিসেমিনেট করতে পারি এই অ্যাওয়ারনেসটা। তো আজকে আমার মনে হয় যে আমরা যে প্রোগ্রামটা করলাম এর দ্বারা হয়তো বিভিন্ন জায়গায় আমাদের এই অ্যাওয়ারনেস প্রোগ্রামটা ডিসেমিনেটেড হবে। থ্যাংক ইউ।
Acha, Professor Abdul Salam has joined us. Professor Salam, do you have any questions or comments?
Sir, thank you very much for giving me the opportunity.
He can talk about the pediatric hypertension.
Yes.
Sir. Actually, for for the diagnosis of hypertension in case of pediatric population, we use a device that is a formula, Z score value. We have to measure first. First, the gender of the patient, either boys or girls. The second, the date of birth and the current date. And we should put this information to the apps, and then we put the, whether it is in night or whether it is in morning. Then we put the values of systolic and diastolic pressure, and these apps will give you the where the blood pressure lies, whether it is in 50th percentile or 95th percentile. If it is more than 95th percentile of that measure, in case of pediatric population, sir,
আনমিউট করে কথা বলেন।
হ্যাঁ, আনমিউট আছি স্যার আমি।
হ্যাঁ, ঠিক আছে। না, মিউট করে কথা বলেন।
মিউট হয়ে কথা বলো, তুমি যদি কথা বলো মিউট হয়ে
কথা বলতে চাইলে মিউট হয়ে কথা বলেন। হ্যাঁ, বলেন, সালাম বলেন।
আমি স্যার কোশ্চেন করছে কেউ স্যার?
না 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 না, সালাম বলেন। সালাম টু কন্টিনিউ। ডক্টর সালাম আনমিউট করেন।
Sir, am I audible?
Yes, yes. Continue.
Sir, for the measurement of pediatric population hypertension, we usually use on apps. In our mobile, we set it, we download it, and we usually do accordingly whether the gender, whether the boy or girl.
Now, by this time you have explained it.
Yeah, sir. So in case of pediatric population, we commonly encounter not primary hypertension. Usually, we encounter some kind of secondary hypertension, usually associated with kidney disease or some hormonal problem like that of the pheochromocytoma. These are these things, and we have to exclude it. And if there is any family history of hypertension in case of adolescent patient, we have to check other precipitating factor along with associated with it. So these are the things I want to mention in this World Hypertension Day. So thank you very much for giving me the chance to speak on the occasion of World Hypertension Day. And actually, thank you very much for giving me the chance.
Yeah.
And I'm greetings you from
Professor Salam.
I came here to see my
Dr. Kamrul. Dr. Kamrul, you are with us. Would you like to speak anything? Dr. Kamrul. আচ্ছা, তার না কামরুলকে পাওয়া যাচ্ছে না। আমি আজকে মিটিং এর সবাইকে ধন্যবাদ জানাচ্ছি। এরপরে আমাদের এখানে ধন্যবাদ বক্তব্য দেবেন, ভোট অফ থ্যাঙ্কস দেবেন একমির সিনিয়র জেনারেল ম্যানেজার মিস্টার আবু জাফর মহিউদ্দিন সাহেব। তার আগে আমি একটু কথা বলতে চাই, অধ্যাপক আব্দুল্লাহ আল শাফি মজুমদার ইতিমধ্যে কিন্তু জিনিসটা উত্থাপন করেছে যে বাংলাদেশ কার্ডিয়াক সোসাইটি এখন একটা কাজ হাতে নেওয়া উচিত। দুইটা কাজ, একটা হলো মানুষকে সচেতন করা অন দিস ইস্যুস, পার্টিকুলারলি কার্ডিওভাস্কুলার ডিজিজেস ইনক্লুডিং হাইপারটেনশন, as well as we have to have done the find out the statistics, epidemiological statistics of the diseases in the country, particularly hypertension, ischemic heart disease, congenital heart disease, and heart failure. So I think Bangladesh Cardiac Society has now the ability to continue with this sort of program, with this sort of research activities by ourselves. So আমরা মনে করি যে নেক্সট আমাদের ইসি মিটিং এ we will discuss on the issue and we will take some research activities, particularly on epidemiological survey of the diseases in our country. And এর জন্য যত ফান্ড লাগবে আমরা ফান্ড জোগাড় করতে পারবো এবং আমরা এর জন্য স্ট্যাটিস্টিক্যালি মুভমেন্ট যেভাবে করতে হয় সারা দেশব্যাপী সেইভাবেই করব। কারণ এইভাবে একবার একটা স্টাডি হয়েছিল 1976 and 1984 একটা হয়েছিল, কিন্তু সেগুলো বিভিন্ন হাসপাতাল ভিত্তিক হয়েছিল। এখন এই যদি ইপিডেমিওলজিক্যাল রিসার্চ গুলো আমাদের গ্রহণ করতে হয়, তাহলে এটা স্ট্যাটিস্টিক্যালি যেহেতু ভ্যালিডেটেড করা যায়, সেইভাবে সারা দেশব্যাপী কিভাবে করলে স্ট্যাটিস্টিশিয়ানকে ইনভলভ করে আগে প্রোটোকল তৈরি করে তারপরে এই রিসার্চ গুলো আমাদের করা উচিত। আমি মনে করি this is the time for cardiac society to go with this research activities, and I hope our all members will agree on these issues. এবং এই আশাবাদ ব্যক্ত করে আজকের আন্তর্জাতিক হাইপারটেনশন ডেতে সবাইকে শুভেচ্ছা জানিয়ে আমি আমার বক্তব্য শেষ করছি। এখন আমি ACME কোম্পানিকে ধন্যবাদ জানাচ্ছি যে ACME কোম্পানির সহযোগিতায় আজকে আমরা এই ওয়েবিনার প্রোগ্রাম on the eve of World Hypertension Day we have organized. It is a hybrid program from our office, Cardiac Society office, and webinar. So now I would request Mr. Abu Zafar Mohiuddin, Senior General Manager of ACME, to give vote of thanks. Mr. Abu Zafar Mohiuddin.
Assalamu alaikum, sir. আমাকে শোনা যাচ্ছে, স্যার?
Yes, you proceed on.
Yes, sir. Sir, honorable chairpersons, respected speakers, distinguished guests, moderators.
শোনা যাচ্ছে না।
আপনি আনমিউট করেন।
স্যার, আমাকে
হ্যাঁ, শোনা যাচ্ছে। আনমিউট করেন। আপনি মিউটেড আছেন। Yes, now continue.
জি স্যার। Sir, honorable chairpersons, respected speakers, distinguished guests, moderators, and my dear colleagues, Assalamu alaikum. On behalf of ACME Laboratories Ltd and my own behalf, I would like to express my heartfelt thanks and gratitude to all the physicians being with us today. Today, scientific sessions has truly been a marvelous one. As a proud association of ACME, the scientific partner, I feel honored and fortunate to address the sessions of the vote of thanks. I would like to thank our chairpersons, Professor A.K.M. Mohibullah sir, Professor Dr. Abdullah Shafi Mozumdar sir, by gracing us with their presence. I would like to acknowledge the enriched scientific sessions that enlightened us about the long-term challenges faced by patients who suffering from hypertension, conducted by Professor Dr. F.D. Mamunur Rashid sir, Dr. Abdullah Jamil sir. And also thanks to Dr. Mohsin Ahmed for moderating the entire sessions. I'd like to thank Bangladesh Cardiac Society that helps us to organize these sessions. Dear doctors, hypertension is a disease that surely affects our blood pressure. In order to resist the effects by hypertension, we need to be dependent on medicines. ACME Laboratories Ltd currently has a wide range of products related to hypertension management, and we will continue our research, create and deliver more medicines in the future. I truly hope and believe that your continuous support will tremendously encourage us to arrange such type of scientific seminar in near future. That is all from my side. Thank you very much.
So thank you all, everybody, and we hope that ACME will come forward in future with this sort of program with Bangladesh Cardiac Society, and they all also will participate in our research activities. We hope that it very much. Thank you very much, everyone. And I would now like to conclude the session, and everybody have been invited to the lunch in our office. Thank you very much.